4.5 weeks down, 4 to go.
Or Greater Sydney will be in lockdown for a further 4 weeks till the 28th of August.
Ever since the outbreak began, there have been calls for the whole of Sydney to have a tougher lockdown. Restrictions have now been tightened, but they're not citywide. Residents from another 3 local government areas are now forbidden from leaving for work unless they're an authorised worker. Aged care and healthcare workers in Cumberland and Fairfield, and all workers living in Canterbury Bankstown will need to test every 72 hours if leaving the area for work.
That localised targeted response is what we hope will have the desired effect.
I think what the government is doing in New South Wales is quite reasonable. Testing people who are leaving their restricted LGAs, workers, essential workers, testing them every 3 days for COVID is a very good idea, and it's something we haven't really seen, say, during the Victorian outbreak last year.
In addition to those extra restrictions, the Premier announced that compliance would be beefed up.
I think the real thing that's going to make a difference is lockdown and keeping people apart from each other and making sure that people are not infectious when they're out and about. So I think an extension of the lockdown and making it more stringent is appropriate.
Other measures announced today: construction will resume, although not in restricted council areas. Rapid antigen testing at workplaces and schools is on the way too. New South Wales has made it clear today that it's not looking to the past for its strategy out of this outbreak, rejecting calls to adopt measures like curfews and outdoor masks that Melbourne used last year. Instead, it is looking to vaccines.
We know lockdowns work, and we just have to hold our course. And we also know that we have other tools that we haven't had before. And those other tools are vaccination.
So although with the vaccination, you do need to wait a few weeks for it to be effective, if there's an area where there's a lot of intense transmission and ongoing transmission, then targeting vaccine to that population hopefully will reduce the duration of lockdown, will reduce the duration of transmission and disease in that population, and it might also reduce the peak disease in that population.
Welcome to a very unusual...
HSC students will return to school on the 16th of August. The state will redirect Pfizer shots from the regions to make sure they're vaccinated. And vaccine hubs will accept walk-ins from people of all ages for the AstraZeneca jab.
Vaccination is both a key to individual protection, but also assisting us in preventing that transmission risk. And it does take delayed 2 to 3 weeks, but the more we can see the vaccination levels rise, it will assist us in the control. But we will need the lockdown.
It isn't unreasonable to consider sending just Year 12 students back to school, so a minimal number of students.
As well as tying its freedom to a higher vaccination rate, New South Wales blamed the low vaccine rate for the extended lockdown. And it has extracted a price from the federal government for that policy failure by getting the Morrison government to expand its financial support for the state. A move that conspicuously wasn't announced until Victoria and South Australia started to come out of lockdown.
Over the course of the last several days, indeed up to a week, the federal government has been working on a program of additional support that may have been required should Sydney have gone into a further lockdown.
There's not much to be cheerful about right now. There's the crushing monotony of lockdown, the stubborn rise in case numbers, and the devastating impact on small businesses. But Gladys Berejiklian says there is cause for optimism.
Spring does provide a period of hope. We have seen in the last few days vaccination rates with the AstraZeneca go through the roof.
The challenge is steep though. There were at least 68 people in the community while infectious, while another 64 are under investigation. The goal, for now, is to get that to zero.
Is it possible to get there after 4 weeks?
Well, look, that's obviously our intention, but we've seen how we've struggled to reduce that number of infectious in the community, and that is apparent. But if we want to live freely, whilst vaccination rates remain rather low, that is the one target we need to stick to.
And I think for the people of New South Wales and Australia who are looking on, we have to think of places like Taiwan. So Taiwan has had an outbreak since May 15th or so, which has been addressed with a lot of restrictions, not a lockdown. and they're now down to very small numbers of cases. So there certainly is hope that we can get this outbreak under control.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.